Welcome to On Your Own Terms. I'm Patty Talbot, and this is the place where we learn together what it takes to change the world on our own terms and in our own special way. Today, I am honored to have with me Stacy Fritz. Stacy's a new friend I met through HPS Grad. HPS stands for Heroic Public Speaking, whose tagline is Change the World One Speech at a Time. And that's what Stacy and I've been trying to do together, is create our world-changing messages and get them out into the world in order to make the world a better place. And that's exactly what we're here to do at Blue Roads Education every week when we feature powerful change makers like Stacy. You'll be eager to hear Stacy's message today, because not only does she follow our framework, Homegrown Solutions for a Patchwork World, as she talks about homegrown Stacy and the solutions she's working on to make the world a better place, and the way she's connecting across the patchwork with people and ideas that strengthen her as a change maker, and the ways that she's hoping her message will ripple out and make a bigger difference. But also, you're going to get specific hope for your own health, because what Stacy's teaching us is ways that we can take control of the factors that play into things that often plague us as humanity with regard to our health. So tune in now to hear Stacy's story, and we'll talk more at the end. Stacy Fritz, welcome. I'm so glad you're with us.
Oh, thank you, Patty, for having me. My name is Stacy Fritz, and I am living in Baltimore, outside of Baltimore, actually. We live in the suburbs, Place Towson, Timonium area. And I live here with my husband, David, and my 3 sons, although they are a little scattered. So I would self-define first that I am first and foremost a mom and a wife, and very deeply into my faith before I even kick off anything to do with my career. But then the second part of that is I would have to say for the past 30 years, I have been involved in health and well-being at some capacity or another. I was an athlete as a child and competed in gymnastics and always very active, and then kind of morphed into a competitive runner and a yogi. I have a huge passion for well-being and always have. I am one of 2 children to my parents, and I grew up really actually in South Florida until we moved to Maryland when I was in high school. And I went on to go to college at the University of Delaware, got my master's degree from Gallaudet, which was my first career. Gallaudet, for those of your listeners who don't know, is actually an all-deaf school. You do not have to be hearing challenged at all if you are in the graduate program, but undergraduate, the requirement is that you have some sort of hearing challenge. Yeah, I graduated and I became a teacher. I was actually a teacher for young children. I worked for Baltimore County infants and toddlers for quite a long time until I had children. Birth through 3 were my clients and their families, and it was really working with them via sign language, teaching them how to communicate better. So sort of ironic, the communication piece to my latter career. When I went on to have children, I took some time off from teaching, and always kept my foot in the door with fitness and well-being. I went on to personal train and to teach classes and whatnot while my kids were in their early years, so I could stay home with them, which was super important to my husband and myself. But after they got to the 1st grade, then it was like, oh, what's Stacy going to do next? So I have this big background in teaching, and I went on to get certified in nutrition and movement. I'm a corrective exercise specialist. My business partner and I started a company 14 years ago, which was right around the time that the kids went to full-time school. So she and I started a business, and it started one way. We thought, well, we teach all of these fitness classes at the gym. Where are all the people that can't go to the gym? So Fit to Order, my company, was born out of the need to bring fitness classes on site to various locations. So that's how the business started. Ironically, that is not how the business pivoted. A couple of years later, we really got into corporate wellness and the idea that we needed to do things and stuff during the workday to keep employees healthy. And we saw such a gap in the market. Lots of our competitors doing biometric assessments, testing folks for whatever chronic condition, and then coming back a year later to retest, But there was this middle chunk that was missing, people not doing things to change those assessment results. So at that time, my business partner and I developed a whole a la carte menu of nutrition programs, stress management programs, movement programs that we could take on site to companies. And we did that very well for a very long time until we started seeing the market change a little bit, and companies are busy. Employees were having a hard time making it to these events. So again, another pivot. And what we pivoted to was short micro work breaks that could be done during the workday, with the tagline being move more and stress less at work. So it really has been, my whole life really has been an evolution of well-being, if you will, one. And two, the company has evolved over the years to be these strategic, healthy habits that people can do during the workday. And now, of course, post-COVID, even more. I have been provided for all of these years in my industry, because if I really take a step back and look at what I am doing today, I'm
Yes.
still teaching. And I'm still
Yes.
teaching with my hands, learning different strategies in order to relay an effective message one way or another. And I truly am completely grateful for the 30 years and how it has really manifested to this exact moment for where I am today. And I would wear the hat of lifelong learner and
Yes.
lifelong teacher. For me, my work is really about guiding and inspiring people, whether or not they're at work or at home or anything in between, that how much control we all actually have over our health and well-being outcomes, and how we inadvertently give that away because what once was and what we once believed isn't necessarily the hard truth. And the truth is, and the research indicates, that the majority of our chronic conditions are directly connected to our daily lifestyle choices. I know this professionally, but I for sure know this personally. So you asked, how do I show up in the world? As I mentioned, I am one of two children, born to two wonderful parents. And unfortunately, I lost my brother, it will be 2 years in October, to colon cancer, which was, to say the least, was a huge shocker. It was a huge shocker. He was 46 years old at the time of diagnosis. And here I am, his only sibling in the corporate wellness space. He was a pilot and truly one of my very best friends. And to say that the loss is ginormous is truly an understatement. But bigger than that, his passing combined my personal efforts and my professional efforts and where I'm going in the back half of my life. And he is my true inspiration, why I continue on and pushing. So to answer the question about how I show up, I am a patient advocate on the side. I'm very busy with Fit to Order, but after Brad passed away, and knowing what a wonderful organization, which I was already working with, I really felt it super important to really get in there and to try to send message of that the body has a lot of what it needs to heal, that a diagnosis doesn't necessarily mean a death sentence, and that the quicker that we understand the power that we all have within us to be our own advocate, I think the quicker we're going to be able to demand more from our healthcare system. I show up because of my brother and not wanting anyone to have to experience what my family and I have had to experience over the past couple of years. We, as I mentioned, my husband and I have 3 kids, and he has 3 kids, and now I consider them my half dozen. But the fact that they are living without their dad's physical presence is, in my opinion, that it shouldn't be the case. My brother should absolutely be here, and I believe that his illness could have been prevented had we understood some of the daily habits and how they might contribute toward a bigger diagnosis. So that's my heart work. Everything I do now for Fit to Order and everything I do personally is wrapped around being an advocate and understanding the power that you have over your health. One of the things that I noticed the most while my brother was ill is my limited ability to maintain those really deeper connections. I was laser focused on being a caregiver. I had the 6 kids, my husband, my parents and whatnot. And oh, by the way, we were in the middle of COVID. I felt that tremendously. I have gratitude there because the space opened up during COVID that I could do all those things. But at the same time, the thing that I was missing were those deeper connections and finding the places that we are far better together than we stand alone. So for me, HPS, that's our grad group, for me, there is such rich resources, and I don't necessarily mean opportunities. I am finding like-minded people. I've never been in a group of people where I have felt so unapologetically honest about how I was feeling about an experience, which is in this case doing some speaking on a very, very heady emotional subject. And I give credit creating those connections, as you were mentioning, to that group. That's one source of really big inspiration for me, that I made an honest commitment to myself that I don't want to lose what we had for a year. It's just too special to me, right? They were literally 49 strangers. I knew nobody going in there, and to come out with 49 people that I know that I could call out for an area of expertise or a connection or a resource, which is less about the business opportunities for me than just creating this safe space of information. That's one. My big patchwork piece, I would think, is with my organization, which is Believe Big. I was on the board of advisors for years before my brother got sick. And then, as I mentioned, I joined their patient advocacy team, extremely part-time, but it was super important to me to make sure that I was working in this ground zero level where I got to talk to patients because I knew exactly how they felt. Many of them calling in are caregivers. We don't necessarily call them patients, folks that are going through the cancering journey, and their loved ones. I wanted to alleviate some of that pain if I possibly could. But bigger than that, I've had the opportunity to moderate a show that I developed for them, which is called Food for Thought. And Food for Thought is bringing in well-recognized nutrition oncologists, specialize in food, nutrition counseling for folks that are on this journey. And I cannot tell you the wealth of resources and information and the people that I've met from those people. And going back to ground zero, those folks who I've had the pleasure of not only supporting, but then them turning around and paying it forward to somebody else. I do believe that there's this ripple effect. We use that term in my business too, that it just takes one, and then you never know. I get excited anymore when I wake up in the morning and I think, okay, God, what you got for me today? What connection, what conversation am I supposed to be having today that pushes forward my mission, which is elevate your health and, to really take control, pilot your own health journey. I hope in my lifetime I get to see the opportunity where we can eradicate some of this because people have demanded a better system. In corporate America, there's a different feel, and I'm not complaining or judging on it, but there's this competitive spirit of drive and sales and whatnot. I mean, there are some very successful people in our group, extremely successful, smart. I would love to do what we're doing right now with each of them to find out more. When I get the opportunity to chat with one of you, it's not at all like, can you connect me to your contacts? I really legit want to be grounded in that moment and just, how did you do what you did? Just tell me, because it's just so inspiring. It's more that than what can you do for me, I feel like I've got this group between all of my connections with HPS and church and Believe Big and my work here at Fit to Order, that I'm starting to see a network that I did not see a couple of years ago, probably because my head was down and I was in the grind. I don't feel that way anymore. And maybe it's because of the tragedy that occurred in my house and the motivation behind it. The intensity is still there, but the desire to do it in a way that is authentically present and kind and generous with one another. I'm in a place where it's just all love. I know that sounds really corny, but I'm getting it back in return. I've let go of the numbers are the numbers, and we'll get back to what it was pre-COVID, but I feel like the back half of my life is more heart work than it is intense work. As I mentioned earlier, I sincerely hope that between the messaging and the communication, that my goals of getting on the big stage and sharing not only my brother's story, but then also the connection with all the different alternative and complementary therapies. If I can impact just one person, that could therefore impact the next person in terms of specifically cancer, that we understand that it is no longer a death sentence, and that we are living in a place where we're all mostly still clinically approaching this metabolic disease. And I hope that my work alongside of my colleagues and the intense effort to make those connections so that the other side of medicine, I will call it the Eastern side of medicine, is not only heard, but it's well respected, and that the two parties, I always say, can we just play nicely in the playground? We're starting, and for sure we're seeing, but there are so many wonderful therapies that because that they don't have the definitive science backing, even though there's anecdotal information, there's research and whatnot. I just think that we are still living in a place where we give all of our attention and funding to a place where the results, if you really dig into the research, the results are really not that grand. At the same time, I want to be super clear. We cannot do life without that clinical piece, and I would never want to get rid of Western medicine, but I hope that we find a way to work it out where there's this global connection of we can manage this as a metabolic disease and not as this capital C cancer that we can't survive. By the time somebody gets a diagnosis, they're already anxious, afraid, scared. And my argument is that can you please just, there's so many different, just like in my speech, like if you can look at your health as a dashboard of instruments, and each one of those instruments represents some sort of response. You don't want all those instruments turned on to inflammatory, right? Because something bad's going to happen. But we didn't wake up one day and just smack got cancer, right? I don't want to say the onus of the responsibility is on you, but it's the onus of the responsibility is for you to understand all of the factors that led to that particular moment, and what could we be doing differently, and what could we be doing to manage, I'll call them health whispers instead of health screams, which is what my brother got. Even if my trickle or my ripple effect is coming from my 3 sons, my husband and I raised children to be healthy, happy, independent, and live their life aware of switches turned on. And if just those 3 go on to fulfill their lives and live that mantra, I think that's how we start. We got to start really small and hope that the messaging is clear. And our culture tends to make everything so complicated. And health is really simple. And we've gotten into a very being world where we're just constantly busy and whatnot. Prayer hands up, my children, they're my best thing I've ever done. And I know that the amount of kind attention that I gave to their upbringing will come back. But it was super important to me, if I was going to have that family, that I in turn made sure that they were equipped with the tips, tools, and strategies like I do. And that's nothing if I can do it for everybody else in my business. I mean, certainly I got to start first with the people that live under my roof, and they're all. Imagine experiencing life at 30,000 feet. Your view of the world includes brilliant sunsets and sunrises, rainbows and lightning storms, even when clouds shroud the earth. This is my brother's regular view. He's a commercial airline pilot, and although extremely cliche, my only sibling, Brad, likes to comment that he feels his best both professionally and personally when he is flying way above the clouds, where he does remind our family any chance he can get that it's always sunny with very little turbulence. Whether it's small towns or big cities that pass beneath his wings, I know that my brother values the life of each of the passengers aboard his aircraft. But I do wonder about those passengers. I mean, they gotta be traveling quickly with a million thoughts swirling in their minds. I wonder if they ever stop to ask themselves the question, am I in safe hands? When I talk about health and safety, that word safety often confuses people. We mostly think of safety as in an acute or an immediate situation, like a fall or an accident. But safety in this discussion means the ability to support optimal health at work, including the environment and the appropriate tools. How often do you think that your employees ask themselves the question, am I safe at work? The world's 3.2 billion workers are increasingly unwell. They're growing older, they're suffering from more chronic disease, they're reportedly more stressed, less happy, and yes, many share feeling unsafe at work. Chronic health issues like IBS, pain, insomnia affect 65% of employees. 74% of US desk-bound workers say that they're in pain just from sitting all day long, and low back pain connected to a sedentary lifestyle, both at home and at work, now tops disability concerns according to the global burden of disease. Not so safe, huh? And now that we've all been shook globally thanks to the pandemic, the business of work has radically changed, and the commitment to our personal health, for many reasons, continues to take the very last seat in the back of the plane. Simplifying and elevating employee health is a global leadership opportunity. You are in a unique position today to radically influence the health of your employees, where the byproduct is improving the health of your company. Companies grow and thrive when employees are well. And I believe that the future of work is less about where we're working and more about how we're working. So I think that the question that we need to be asking ourselves is, what do we need to do to create a more life-giving culture that most impacts your employee and your company health? Better yet, what is one thing that you can do today that would most support a health-positive work culture? Thank you. My company, Fit to Order, we specialize in sedentary solutions. What I do for a living is I work with companies whose employees sit the majority of the day. And so my job is to figure out ways that don't disrupt workflow, that allow them to do micro movement and de-stressing. So the last thing I was going to say was, super excited if anybody who's listening to your show, I'm releasing a new product, and I am really going to focus hard on my messaging in the very near future with the power of simple breath and how it's so important to your health, and why we as a culture don't do it very well, and what we can do to take a fuller, deeper, more intentional, life-giving breath. So my new product is a little teaser. It will be released January 1. I created this product, and you'll hear more about my brother's story in the Vita Ball. I'll tell you the name of it. It's called the Vita Ball. We're all over social media with Fit to Order, FIT, the number 2, and then the word order. That's probably the best way. Of course, you can always reach out to me, Stacy KF at fittoorder.com. You will hear very soon about the Vita Ball, because like I said, can't get your hot little hands on it till January 1, but you'll hear more about it in the next few weeks. And I'm certainly super excited that I told you my heart career, but this product is like the heart product. So more on it to come. I'm sure you're.
Thank you, Stacy. I just love to hear you talk, because you inspire me to take control of those switches, those on-off switches, that I can do a better job of taking care of myself by making sure the right switches are on and the wrong switches are off, so that I am in control of my health to the greatest degree possible. I know that our audience here will want to look up your business, Fit to Order. That's fit, the number 2, and the word order, as you said, to find out how they can get involved with your work. They will also want to keep a lookout for that Vita Ball, because I'm very curious, and I know they are too, about how that's going to work and help us maintain and support our health. I also know that they will be wanting to look for opportunities to hear you speak. We got just a taste of that today. And I can tell you from rehearsals that Stacy and I've done together that her entire speech is full of great information, and she is one heck of a storyteller. You will not want to miss it. Next week, we'll be featuring a new changemaker, Glenda Clare. This is a friend that I've never met before, and I get to interview her early next week and find out her changemaking story. So tune in next week to hear Glenda Clare's changemaking work on her own terms. In the meantime, may you be grounded in your beingness, guided in your doingness, generous in your connectingness, and inspired in your reflectiveness, so you can change the world on your own terms, from the inside out and the outside in. I'm Patty Talbot. I'm always learning, and I know you are too.